In this lesson, we're going to look at some of the core principles of what guides our practice as nurses. When we first look at what we call the overall guiding forces of nursing practice, we need to look at several main principles. These are ethics, legal implications, so what laws do we follow, nursing prioritization, and safety. These things all function to serve as like a wall on a house. They all fit together and provide the foundation for the rest of the house, much like our nursing practice. Today, we're just going to hit the high points, but be sure to check out the other lessons to get more details on safety, legal stuff, and nursing prioritization. But in the meantime, let's dive in. When we look at ethics in nursing, what does that mean? Well, the American Nurses Association currently houses the Code of Ethics, and it's a pretty solid outline of what guiding principles are regarding ethical issues. So go take a look, and they have a pretty nifty resource for it. There are 7 foundational principles in nursing ethics, which we'll go over. The first one is justice. This is being fair to every patient that you care for. Every patient should receive the same high-quality care that you would deliver to someone like your grandma. That includes race, sexual orientation, gender, culture, religion, political views, or anything that may make you skew your view of them. Our responsibility is to the patient and to the profession, so we want to make sure that we continually deliver the same care to every patient. For example, the first patient that I had as an inmate was a convicted sex offender. But because I didn't know it at the time, I continued to provide the same quality of care for him as I did for the little Meemaw in the next room. Had I had that information before, I still would have been responsible for ethically delivering the same quality of care. The next one is beneficence. This means doing good, but not just doing good things. It's doing the most good for the patient. For example, clustering care for a patient in pain is doing the most good because you're examining them on the whole. The goal here is if I do all of their care at once, when I'm minimizing the amount of time they're in pain. So you're doing the most good, and that's what's most good for the patient. This leads me to my next point, non-maleficence. I know it's a mouthful. On every talk show, podcast, TV series, or whatever you have, they always say something like, do no harm. This is different than beneficence. Being non-maleficent means that you'll do whatever is in your power to not harm the patient or to avoid harm at all costs. Let's go back to our patient in pain. If you need to turn them, you know that they're going to have some pain. One way of possibly avoiding this is to consider giving their pain medications 30 minutes prior to turning. That way, the process of turning them doesn't hurt them, or it's at least minimized by the medication itself. Another thing we want to consider as nurses is being accountable. It simply means that you need to own it. Be confident in your care, but also know that when bad things happen or they don't go as planned, be responsible and accountable for whatever mistake you did, and do not pass that blame to someone else. If you accidentally gave your patient the wrong dose of medication, own that responsibility. You are in charge of the care you give in both the good and bad times. The next one is fidelity. Fidelity is being faithful to your practice and your patients. For example, imagine if your patient has HIV and they've asked you not to share that information with the family, and you agree. That's fidelity. The point here is that the patient entrusts that information to you that you promise not to share. The next one is autonomy. Autonomy is the idea that every patient is unique and individual. They may have their own cultural or religious practices that are personal to them, and you must do whatever you can to honor those. More importantly, every patient has a right to refuse any aspect of care. Not only is it their right, it's also important that you tell them that they can refuse care. Veracity is being honest. Do you deliver the heartbreaking news of a cancer diagnosis to a patient? No, that's the doctor's responsibility. But what veracity means is that you shouldn't lie to patients or their family members. Sometimes these situations are tough, but being honest with them is important. For example, if your patient is not likely going to walk again after suffering a spinal injury, it's important, and more importantly, it's okay to tell them that, but in a supportive and caring way. Now, let's look at some legal principles. Forewarning. Some of this stuff is extremely boring, But as nurses, we need to know some general principles about the legal system and how it impacts what we do. There are several different state and federal laws which impact you as a nurse, so be sure to find out what those are where you live. There are also facility policies. So in other words, these are the rules that apply to you at work. Check with your management or leaders for the ins and outs of those. There are also some aspects to criminal and civil law and even patients' rights, which are covered in other lessons, so be sure to check those out. Quickly, I want to hit on one important note. Patients have the right to refuse care, any aspect of care. So educate your patients so that they know that they can do that, especially in situations where there's confusion and they may seem uneasy. Be your patient's advocate and make sure that they know that they can say, wait until they're comfortable. For example, if a patient tells you that they're uncomfortable with the doctor performing a procedure or that they don't know why the doctor needs to do it, let them know that it's okay to say, hold on until they better understand. As nurses, we have to prioritize the care for our patients, and the way we do that is through the nursing process. We use the acronym ADPI, which stands for Assessment, Diagnosis, Planning, Implementation, and Evaluation, and it helps us remember what we need to do for our patients. This is a circular principle. So basically, once you get done with the last thing, you're going to start back over. There are multiple lessons for the nursing process, so be sure to check those out. But as an example, let me show you what I mean. So if my mouth is dry, I'm assessing that my mouth is dry. So my diagnosis is that I'm thirsty. So my plan would maybe be to drink some water. I actually drink the water in the implementation stage, and then I evaluate. Am I still thirsty? If I am, I start this process over. If not, nope. Then I'm good to go. So what are some other important aspects to nursing prioritization? Well, critical thinking is one. I'm not going to lie, but this is a big challenge for nursing students. This idea that you just get to study critical thinking is just not logical. It's a development of over several key principles. First, it's gained with experience. You need time to develop the skills necessary to practice prudently and safely. Second, it's built with knowledge. The more you learn throughout nursing school, you'll put those into your nursing toolbox, and then you'll be able to pull from it and apply those principles. And last is competency. Being competent shows that you've shown that you can recognize, evaluate, process, and deliver care with accuracy and confidence. There are two lessons that you should check out. One is critical thinking, and the other one is thinking like a nurse. Another important principle is safety. I'm going to touch briefly on this, but it's a foundational principle of nursing. The one question you should ask yourself every single time is, am I being safe? Or is what I'm about to do a safe thing for the patient every time you go to touch a patient? Safety is a crucial factor for nursing care. So if you're not being safe, then you should reevaluate either what you're doing or how you're doing it. One other thing to think about is what you're about to do safe for you? Examples of this are like transfers or moving patients up in the bed. If you're going to injure yourself or put yourself at risk for the sake of time or being rushed, then you should pause. Because if you can't give a patient care because you hurt yourself, what happens to the care of the patient? It suffers, and you don't do yourself or your patient any favors because you've injured yourself or you put yourself in harm's way. A good example of this are the oxygen masks on a plane. The instructions are always to put the mask on yourself first because you can't help anybody else if you pass out. There are multiple lessons on safety, so be sure to check those out. So we've gone through some of the guiding principles of nursing care, and we've touched on ethical and legal practice. And so those are essentially what laws you should follow and what ethical principles should guide your practice. We've covered some nursing prioritization. So that's how we should think about the care we deliver and safety. Nurses should always be safe nurses, both for our patients and ourselves. So now to recap: ethics. Ethics are the things we do based on the 7 principles: justice, beneficence, non-maleficence, autonomy, veracity, fidelity, and accountability. And they're all for your practice. You want to treat every patient as if they're your grandma. Follow the laws of your state and federally. Refer to your state practice act for details and follow the facility policy when giving care. As a nurse, always use the nursing process. This will help to prioritize your patient's care. Always be safe. Safe for your patient and safe for you. The last thing to remember when you're educating your patient especially is that they have the right to refuse any aspect of care, and you should respect them and their wishes. Well, that's it for some of the fundamental aspects of what guides us as nurses. Be sure to check out all the lessons on safety, legal aspects of care, and the nursing process. Now go out and be your best selves today. And as always, happy nursing.